Noswaith dda, a chroeso cynnes I chi gyd. Good evening, everybody, and a warm welcome to our digital showcase. I want to start by saying a big thank you to our alumni, staff, donors, friends, and supporters for joining us today. You're here tonight as part of the Cardiff community, comprising our graduates who finish their studies at Cardiff, of course, and also our friends who are supporting the learning and research of the university. I should say that you'll already have noticed that the event's being recorded, and we'll send you the link following the event, which you're welcome to share. My name's Colin Reardon. I'm the President and Vice-Chancellor of Cardiff University and your host tonight. Now, this evening, our focus is on our research in young people's mental health. And I'm delighted to be able to introduce two colleagues, Professor Francis Rice and Professor Simon Murphy. Francis is Professor of Developmental Psychopathology in the Division of Psychological Medicine and Clinical Neurosciences, and her main research interest is in identifying what causes adolescent depression and why it recurs. Simon is Professor in Social Interventions and Health in the School of Social Sciences, and he researches social science approaches to improving the health and well-being of children and young people. Both are key staff in the newly opened Wolfson Centre for Young People's Mental Health, which is a dedicated research centre focusing on reducing anxiety and depression in young people. The centre hosts Cardiff University experts working in partnership with Swansea University, the Welsh Government, NHS Wales, university health boards and schools across Wales. Part of what makes the centre so important is the sheer quantity and scale of the data that it collects and processes, allowing our researchers a national testbed where research can seamlessly inform policy and practice with the potential for rapid benefits for its 1.1 million young people. All of Wolfson Centre's scientific findings will be developed in partnership with young people, practitioners and policymakers. The information generated will then be used to shape public health and school policies with the aim of helping promote better mental health in young people. And I think we're all aware that the effect of COVID goes well beyond the physical effects of the virus on people. It's had a major effect on mental health in people both young and indeed all ages. In terms of the format for this evening, we're going to have an opportunity for a Q&A at the end of the presentations. So if you do have any questions as the presentations continue, please enter them in the Q&A box at the bottom of your screen at any point, and we'll get to as many questions as time allows. I'd like to start by welcoming Professor Francis Rice, who will kick us off with the first presentation.
Hello, everyone. It's a real pleasure to be able to tell you a little bit about some of the research that we've been doing at Cardiff University in this area of young people's mental health, particularly around adolescent anxiety and depression. So what I hope to do is give you a flavour of some of our research and really try and show how that will sort of translate into future research that's planned as part of this new Wolfson Centre for Young People's Mental Health. And the bulk of that research is starting early next year. So anxiety and depression are really common mental health difficulties. So I need the next slide, please. They often start early. So typically anxiety will start earlier than depression. And for depression, the teenage years are an important vulnerability period where symptoms of depression and depressive disorder become more common and often emerge at this time point. So importantly, these symptoms and conditions cause the young people who experience them significant distress. They can impair young people's ability to go about their everyday life, so particularly in school and their relationships with friends and family. And they can really alter people's life chances over quite a long period of time. So it's often the case that people who experience these difficulties early tend to re-experience them in later life, in adult life. I mean, that said, some young people do thankfully emerge unscathed and do function well in adult life. So one particularly striking statistic, so I need the next slide, is that up to 3/4 of young people who would meet criteria, strict criteria for an anxiety disorder or depression, go unrecognised. So they don't seek help and they don't receive any intervention, despite really strong evidence that early intervention would likely reap long-term beneficial effects. And so lots of our research, current and planned, really tries to include this unrecognised majority of affected young people. So what I'm going to do next really is pick out 2 examples from research questions. So there are 5 interrelated research packages as part of the centre's work, and I'm going to take 2 of these and focus on those and really try and explain what some of the practical benefits could be from this research. So if I can have the next slide, please. So one of our research questions really focuses on young people whose parents have got depression. So depression in a parent is very common. It's probably the most common potent risk factor that increases the chances that a young person might experience anxiety and depression themselves. So estimates are that around 1/4 of children have a parent with a mental illness by the time they're 16. So it's very common. This group also represent a major lost opportunity for early intervention. So bodies such as the World Health Organization has identified young people whose parents have mental ill health as meriting special consideration for early intervention. But our own research shows that in this group, there also is a lack of access to services when young people really do need to seek help. So that's in spite of evidence that their parents are actually known to services as well. So what we plan to do in the new centre is to test a new intergenerational intervention to see if that can reduce the chance that a young person might experience depression in the future. So that involves talking therapy with the young person when they're showing early signs and symptoms, as well as more optimally treating parental depression when they're in a current episode. And this will also allow us to much better understand some of the mechanisms of the intergenerational transmission of both risk and resilience. And that will involve bringing together research studies where we track development over time to really much better understand some of the processes involved so that we can better support families like this. So if I can move on to the next slide. So one of the next questions that we plan to focus on as part of our work is really around trying to understand variability in outcome and beginning to address the possibility that heterogeneity within depression could be stratified, and this may be helpful. So we know that the outcomes of young people who present with anxiety and depression are highly variable. So typically these tends to continue into adult life, but that is not always the case. And a substantial minority of young people will recover well and function well in adult life. And then for a smaller group of individuals, these symptoms might herald the emergence of a different type of mental health condition, for instance, bipolar disorder. And it's very difficult for doctors and clinicians, for instance, to be able to differentiate the potential future outcomes for young people that they may see in clinical practice. And clearly that's important for treatment. The other thing that we hope to do is really think about stratification of depression. So this is an example of a paper that we published about a year and a half ago now, looking at the development of depression over time in a population sample. So this is from age 10 to 18, so where depressive symptoms are measured repeatedly over time. And we find evidence for two different forms, if you like, or trajectories of depression. One that starts very early, where symptoms emerge at around the age of 12, and this is associated with earlier social communication difficulties in childhood, as well as genetic risk for neurodevelopmental conditions, in particular ADHD, so attention deficit hyperactivity disorder. And then we see the yellow line, a more typical later adolescent onset trajectory, where symptoms emerge at around the age of 16, and that's associated with genetic risk for depression, but not these earlier neurodevelopmental difficulties. So if I can have the next slide. So what we really hope to do as part of this new centre is really make use of very large scale population data sets and clinical data sets to ask whether we can identify social, clinical, and as well as genetic characteristics that can explain some of this variability and outcome that we see across young people affected by anxiety and depression, and also begin to evaluate the usefulness of stratification and measures to quantify individual absolute level of risk, because we know these vary markedly across people. So if I just finish off with the last slide. So it's a little bit of a whistle-stop tour, but I hope I've given you a bit of a flavour of some of the research that we plan to do. As Professor Riordan said in his introduction, this new centre is very much a team effort and involves working in partnership with Swansea University, lots of stakeholders, including young people themselves, but a really major theme is working with schools, and that involves working with Simon Murphy and his team, really around trying to optimise the school environment in partnership with schools to support all young people's mental health, as well as ensure that there are materials and processes in place to ensure that young people who are presenting at school with difficulties can get access to early intervention. So I'll pass over to Simon.
Thank you, Fran, and good evening. As Fran said, one of the programmes that we're going to take forward within the Wolfson Centre focuses on schools. And our approach to schools is to think of them as a whole system, and what within the system actually promotes positive mental health for young people, because in doing that, we can start to deal with reducing the types of demand on mental health services that we're seeing. So our approach within the centre is to really follow what's being termed by the World Health Organization as a whole school, healthy school approach to well-being. And that recognises that it's not just about the curriculum and what pupils are taught within school that's important, but it's their experiences within it, and also how staff interact with them, the leadership, the workforce support, and their involvement in the school's everyday life. And some of the work that we've been doing in Wales has already sort of identified some of the sort of key processes in schools that actually might be protective for young people's sort of well-being and mental health. So, for example, along in 2017 and 20, we've identified that positive teacher relationships with pupils actually results in better well-being outcomes, and the association of those is much stronger in the less sort of well-off pupils within schools. So, for example, care experienced children will actually benefit much more from good relationships with teachers. And we also find that the schools that actually emphasise health in their everyday activities have better attainment and attendance outcomes as well. That improvements are actually stronger in the less affluent schools, the schools that are in the poorer areas. So it really emphasises the potential for schools. But I suppose one of the difficulties is that we see large demands on schools and a real focus on attainment, and often health gets squeezed out in everyday activity. And we also see often a lack of availability of evidence and how that is communicated to the teaching and education communities, and their ability to take that evidence and put it into practice as well could be improved. And some of those challenges led us a few years ago to think about whether we could learn anything from the clinical research networks, because it wasn't that long ago when clinical research faced some of these challenges. So in Wales, we've developed up a really unique infrastructure to help us sort of, to meet some of those challenges. So if we move to the next slide. So next one again, sorry. We've developed up the School Health Research Network, and within that we've developed up a whole national infrastructure for collecting data from schools and senior management teams, and that's on their pupil health and well-being, and that data is fed back to all our stakeholders, so our partners in this, so Welsh Government, Public Health Wales, Cancer Research UK, and obviously all the schools and the pupils across Wales. And that sort of relationship that we have with those stakeholders in schools lets us work with them to develop the research studies and also to translate the evidence more effectively. So we're really interested in developing capacity up for using that evidence and understanding it and getting it into policy and practice much quicker than we have done in the past. So if we move to the next slide. You'll see that from 2013, when we started this endeavour through a pilot funded by the Medical Research Council, we've moved very rapidly to a position in 2019 when we had every state secondary school participating in the network all across Wales, and that's 211 schools. And that really presents a unique infrastructure in Wales for just generating knowledge and getting it to make a difference. So if we move to the next slide, I'll say a little bit about how the data really drives all the activity that we're going to be doing in this programme of work. So every other year we do an electronic survey with the pupils in Wales, and we also do a senior management assessment of all the types of policies and practice that they have in the school. So how are they involved in the school? What type of policies do they have around bullying and exclusion, for example? What do they teach in the curriculum? Do they have availability of healthy foods and water? All these sorts of things. So in our last survey, which was in 2019, we had 91% of schools participating. And in terms of the pupils that completed it, we had 67% of all 11 to 16-year-olds in Wales completing our survey, which translates to about 120,000 pupils. And because of the size of that, we're able to look at more vulnerable groups and look at what their health needs are and how they're responding to their school environments. And even with the school environment questionnaire, we had a 75% response rate from senior management teams. So it's a really heartening engagement that we get from schools. If we move on to the next slide, I'll just say sort of very quickly about how we're using that data to really make a difference in Wales. One of the most important elements of the network and our work is that the schools and the pupils themselves get their data back. So every school that participates in our work actually gets a tailor-made school report, which benchmarks how they're doing against all the other schools across Wales. And they can use that for local action planning, and in 2 years' time they can see what difference it's made. And we also provide similar data for regional stakeholders. We also give Welsh Government national indicators so they can see over time what the state of play is in Wales and think about their policy development. And we also have partnerships across Europe that are running a similar survey, and so every 4 years we have an international comparison. We also are able to feed back the data about the relationship between what's happening in the school and the pupils, to the schools themselves. So we do webinars, we do lay summaries, we have network events, so that we can talk about, you know, what's working well in the system and how can it be improved. And for us as researchers, the great thing is that these are research-ready schools, and we can go to them and say, are you interested in these sort of studies around, for example, bullying or mental health? And we've been able to support a portfolio of studies that's currently around £28 million. And the final element of this is working with national government to evaluate the policies they're developing. So one of the key things we're going to be doing over the next few years is evaluating their whole school approach to mental health. So we've already got the baselines, and we're going to have the outcome measures, so we'll be able to do that in a very efficient way. And if we move to the final slide, it's really flagging up how we're not only making a difference in Wales here, but we're starting to influence sort of activities and strategic developments in the UK and beyond. So the good practice that we've developed in Wales has already translated to Scotland, and we've set up helped set up a sister network called Shine up there, and we're already planning to do sharing of knowledge across those things. And we've also done a pilot with the World Health Organization in a number of European countries to see if we can replicate what we've been doing in Wales out there. In the UK, in England, we've been working with the Department of Health Education to see whether we can help them with the setting up of mental health outcomes framework. And with the Medical Research Council, a lot of the learning that we've taken from engagement and high response rates and participation of pupils has gone to inform their plans for setting up future mental health cohorts. So overall, the work of Cardiff University is really playing a part, and particularly what we're doing with Wolfson in the UK stage and the world stage. So I hope that's sort of been a useful oversight in terms of that one programme. Thank you.
It has indeed, Simon. Thanks very much. Thanks both of you. Thanks, Francis, too, for fascinating presentations. We have a few minutes for questions. We've had some through on the Q&A there. We also had some that were sent in advance. Maybe we'll just start with one of the advanced ones, which is what opportunities and challenges has COVID-19 had on your research? Francis, do you want to pick that one up, or was it Simon?
Well, I'll go, and I'm sure Francis will chip in. I mean, obviously, it's a big challenge for everyone in all the different aspects of their work. I suppose one of the things that we've found is obviously all our stakeholder partners are focusing on firefighting the pandemic, and there's always a risk in that in terms of the longer term impacts, particularly around mental health, might get a little bit lost, and that's been really illustrated by some of the studies that we haven't been able to conduct at the moment. We've got one that we would due to start looking at domestic violence, and it hasn't been possible to take that forward, but it's actually one of the sort of key things which needs to be looked at during COVID. But on the opportunities wise, what I think we've all observed is that the development of innovation and I suppose translation to policy and practice, and the translation of doing the research and getting it to affect policy practices has sped up. So I mean, that's a really good thing. And I suppose the final bit is what I've talked about with the SHRN data. We collected that in 2019, our next one's in 2021. So we've probably got one of the unique data sets in the UK which can actually have a before and after look at these sorts of things. So.
Okay, that's very helpful. Thanks very much. I'm going to be a bit selective here, but there was one more in advance that was an interesting one, which a few people asked. So are anxiety and depression becoming more common, and if so, why?
Yeah, so I'll take that one. So clearly this is quite difficult to work out. So identification and knowledge, I suppose, of the public and of practitioners who make diagnoses are important. The best evidence really to suggest that anxiety and depression are becoming more common, at least in teenagers, are these repeat cross-sectional surveys that we have in the UK over time, which use exactly the same measures, and they do that become more common, at least in teenagers, in more recent cohorts, so more recent years. It's not clear why that's the case. I suppose one of the things I could perhaps highlight is that, say, our colleague Stefan Kulishor this is an area that he's particularly interested in, and he's planning on sort of investigating some of the reasons why this might be, for instance, looking in the Shern and other data sets. Clearly, one of the things that people are concerned about are social media and these sorts of things, and these are possibilities that could be investigated in this future work.
Thanks very much. And on the Q&A, there's some sort of other linked questions. So Eleanor asked, what is the greatest challenge for schools in terms of young people's mental health, and what interventions could address it? A similar one on, can you share an example of a finding or intervention that's making a practical difference in schools? Who would like to go on that?
Probably me. Yeah, I suppose there are challenges in a number of areas with schools. I mean, one of the challenges is like how do you create a healthy environment for everybody in school, a more sort of universal approach, because that has benefits for all pupils and can have an impact on the pathway, that reducing the demand on services. But there's another element which Fran talked about earlier on. It's sometimes called like the missing middle. It's the pupils that aren't identified and aren't diagnosed, that don't then meet services, and that's probably the thing that we know least about. And that's one of the more important or exciting areas that we think we can make a difference in. And the third area is like, how do you improve services for young people once they get there? So within schools and school-linked services, there's work to do there. The bit about, do we know if there is a particularly effective intervention? Well, there is emerging evidence, both from England and India, which shows that this whole school approach, particularly the relationships between pupils and teachers, and the feeling that pupils have of being part of the school and participating in it and controlling what happens in the school, seems to be making a difference for well-being and mental health outcomes. So again, that's one of the things we're going to work with Welsh Government, because they're developing a strategy around this. So we're interested to see if it works.
Okay, thanks so much. There's one or two quite specific questions on the chat that we could potentially follow up, I think, afterwards in written answers. But Nick's got a very specific one on governors. Do you work with governors?
Within the schools? Well, yes, through the school communities. So we would. This is one of the things we're really interested in looking at as our next step, is how do you engage parents in what we're doing? So, you know, in a sense, we've done it with the teaching community and the senior management teams. We've done it to an extent with the pupils, but it needs to be developed. I think the challenge is engaging with parents. So we've got plans in next year to start developing up a parents network within it, and I think that, you know, the governors and those links with schools are going to play a key part in that.
Thanks, and I think we've got time for one last one, and this is a question for both. Now, it looks to me like a very good question from Alexander Kaito on the Q&A there. What's the relationship between personal agency and the development of mental health issues, in the way that physical well-being can be improved with diet and exercise? Are there similar support structures for mental health conditions?
Can I go first? So I agree. I think that's a great question. So certainly for common mild to moderate mental health conditions, I think this has quite an important role. So lifestyle factors, sleep hygiene, exercise, you know, these sorts of things. There are lots of things that people can sort of take a proactive role in monitoring their well-being and mental health. For certain other more severe conditions, professional help is needed. So I definitely agree that personal agency is important in monitoring, particularly for people who've got maybe recurrent conditions and mild to moderate conditions. But we mustn't forget that some people really need to seek help.
Thanks. A final word from you, Simon?
Well, I'd agree with what Fran said there. I think there are things that are definitely around sort of the prevention on that universal approach. I think that missing middle bit, then that's the challenge. Is like how much around that is agency and how much can we address it through that and other ways.
It's a complex area, but it's been incredibly interesting and insightful. So thank you very much both for your time, and thank all of you for attending now our webinar audience. I hope you've enjoyed it. If we didn't get a chance to answer your question, we'll follow it up with you directly, and I hope you had a chance to see what fantastic research does take place here at Cardiff and what great people we have. And we're very grateful, of course, for the support from the Wolfson Foundation that we've had to be able to do this research. If you would like to support us or find out more information, we'll put a link into the comments. We do have a programme of events coming up. The next research event's on the 29th of September, looking at Cardiff research on arthritis and the opportunities for personalised medicine. That's a big thing, stratified or precision medicine, so looking at how people's individual genetic makeup affects the way they react to illness. And then on the 22nd of October, looking at stem cell research and finding an effective treatment for breast cancer. So you will get an email tomorrow with a copy of the recording and links to register for forthcoming events. And we hope we'll be welcoming you back to another event very soon. So thanks very much, everybody. Diolch yn fawr a hwyl fawr. Thanks and goodbye, and thanks for attending. Bye now.